Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Surita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everyone, and welcome back to the Functionally Enlightened podcast. Today's special guest, Dr. Torkil Færø, is a medical doctor, an emergency physician, and a best-selling author of The Pulse Cure, where he explores how heart rate variability can unlock better health. With over 25 years of experience, including work with Doctors Without Borders, Dr. Færø has seen firsthand how lifestyle-induced stress fuels chronic illness. We can all relate to that here, and my audience can definitely relate to that. Now, he's on a mission to empower individuals to optimize their nervous system, balance stress, and take control of their well-being using wearables and biofeedback devices. His book was voted Norway's reader's favorite in 2023, and his insights are transforming the way we approach health. All right, Dr. Færø, let's dive into it, and especially into the Pulse Cure. I'm really intrigued by the concept of using HRV as a window into our stress response. So can you tell us what inspired you to write The Pulse Cure, and how did your personal experiences shape your approach to heart rate variability and health tracking?
Yeah, thank you, Sharon, and nice to be invited here. Yes, my way into being interested in heart rate variability was some interesting circumstances. I was actually sailing close to Tahiti in French Polynesia, and I was reading a book by Bessel van der Kolk, The Body Keeps the Score, about how the psychiatrists in the US were using heart rate variability to measure the autonomic nervous system of their patients. And just a little bit later, I became aware that we could track heart rate variability with smartwatches and rings and all the new devices that are available, and many people already have on their wrists. And I understood that this is a powerful tool, and it has not been exploited, or many people are not aware of the potential that is in these devices. So I wrote The Pulse Cure, which is actually the world's first book on how to use the wearables compared to lifestyle strategies. And it's been, as you said, a huge success in Norway, still on the bestseller list after 2 years, translated into 7 languages. And it's a book about the best advice on sleep, nutrition, exercise, how to find rest, stress management, and so on. And then coupled to heart rate variability.
Very cool. So it's interesting that we're having this conversation. I kind of mentioned offline, but I'm participating in a POT study where we're measuring heart rate variability at 2 times during the day, first thing in the morning before any, for all of the participants, before any pharmaceutical intervention or supplemental supports, even before electrolyte consumption. So that is at laying position, sitting, and then standing. And we're doing that with a keto heart rate monitor that clips into the ear. So this is just like a small device, not really comfortable to use long term, so just for those increments of study. But I wonder, with all the wearable technologies and, there's more accessible testing, you talk about using different monitoring equipment and different applications. So are there any that have clinical advancements that are beyond the standard, like an Apple Watch, for instance, that we would have?
I think the tracking of the Apple Watch is okay. And also on most of all other devices are okay. They may not be as good as an ECG device. And I was using, for the first couple of years, I was using an ECG-based monitor, like I was attaching to my chest with with tape. And when I started using the Garmin watches, I could see that they're as accurate, almost as accurate as these ECG devices. So the main thing is how they present the data to you. If it's understandable, if it's actionable. And in that sense, just now I have five devices on me because I'm comparing it to see how they're all doing. I have the Garmin watch, I have the Whoop band, I have the Oura ring, a Samsung ring, and then a Norwegian ring. Um, and they're all really good. So, but I would say that the Garmin watch is the best of them all, by far, actually, because they give you results 24/7. It's easy to see. You see when it's in the parasympathetic mode, it's blue, and then when you get into the sympathetic stressful mode, it's kind of more and more orange colored, and it makes it easy to detect where the stress lies. Because when you have your system where you check it in the morning, in the afternoon, you get the result exactly at that moment. But what affected the stress levels, measured by the heart rate variability, you wouldn't know. You wouldn't know necessarily if it was the dinner you had at 6 o'clock, or if it was the meeting at 3 o'clock that was stressful and affecting the stress levels. So that is why I mostly recommend the Garmin watches, which is also of the cheapest options that you have.
Okay. Okay. So you connect heart rate variability, or HRV for short, you connect that directly to autonomic nervous system. And I think you mentioned in your book how it reflects the balance between sympathetic and parasympathetic dominance or branches. So if
Yeah.
I'm understanding correctly, lower HRV actually means that we're stuck in fight or flight mode. Is that correct?
Yeah, so in general, the lower the heart rate variability, the more sympathetically activated you are, and the less access you have to the vagus nerve. But there are so many factors that will affect the heart rate. So any strain on your body, whether it's the food you cannot tolerate, whether it's alcohol that you have been drinking, whether you have been training too much, whether you have a mitochondrial dysfunction, whether you have a dysautonomia, in your autonomic nervous system, there are so many things that can affect your heart rate variability. But in general, I would say it's a combination of the state of your autonomic nervous system and your general physiology, your mitochondrial state, so to speak. That would be the main things affecting your heart rate variability. And the lower it is, the more stress state you are in. And it will be a very individual number. So the baseline will be different from anyone. So it's not necessarily so that if you, for example, have a heart rate variability of 25, that you have a worse health in general than one with a heart rate variability of 40, for example. So there will be some genetic variations here, which is important. So you should only compare your heart rate variability with yourself and with your best days, and then try to find out, for example, if you normally had a heart rate variability of 25 and then one day suddenly you have it 40, you should try to find out, okay, what happened on this day? What of the choices that I made this day or the circumstances resulted in this difference in heart rate variability?
Mhm. And what is the expectation in positional alignment? Again, if we're changing orthostatically from laying position to sitting position to standing position, are we expecting to see like a higher variability while standing? Is that typical, or would it be the same, kind of just dependent, everybody's differently?
I would guess it would lead to a lower heart rate variability once you are standing, because you need more sympathetic activation to keep the heart rate and your blood circulation going. So I would guess in most cases the heart rate variability while you're standing up would be lower.
And your book also highlights the HRV as a key indicator of stress and resilience. So, what are some of the most effective lifestyle changes that you've seen work or help to improve HRV over time?
Yeah, the worst stressor of all would be alcohol. So I haven't heard of anyone starting to track their heart rate variability that has not cut down on the alcohol consumption. Many people totally out, but most people minimizing it to some degree. Because according to Whoop, that tracks their users' habits, because you can put in what you've been doing in that particular day, they can tell that alcohol is by far the worst stressor. And after you've been drinking alcohol, it actually takes 5 days until your recovery state is back where it was before you were drinking. So if you're drinking then maybe 2 times a week, you will never know your best days, you know.
Right, right. Wow, so the baseline would not be known. I haven't had alcohol in about 5 or so years since I began my chronic illness journey. And I know that that's something that's difficult for many people to want to give up unless they've been in dire state, unless they've already either they're really in tune with health and wellness, or they've been through the ringer with their own illness. So with that, that's an excellent piece of information that, every 5 days, you need more than 5 days time to basically clear the effects of what alcohol is doing. And I wonder if that's really correlating with the blood sugar instability that it can also bring on.
Yeah, the blood sugar would probably be more on a short term basis. But that is also interesting. So I've also at times used the CGM to see how my body reacts to the variations in blood sugar. So that is also very interesting. And the curves of the stress levels will also be affected by the blood sugar. So that would also be important. And I think it's worse when you see the stress levels. Food is a big stressor. That is something I did not know until I started tracking my heart rate variability. When I could see that certain foods, like things containing gluten, milk, and such things, ultra-processed food, would stress my system quite a lot. And also, you will quickly see when you start tracking your heart rate that late night meals or later than 3 hours before you go to bed will affect the quality of your sleep. And it will be more stressful during the night. So that is also something that most people that start tracking, they will cut down on late night meals.
Okay, yeah, and I think it's a wonderful option for people who don't want to use a CGM or don't want to do the finger prick testing to test what is triggering them and what is keeping them in their, like, I guess, a hypervigilant state. I actually have a CGM on now, and I'm tracking things because I've been on a therapeutic ketogenic diet for more than 2 years. So I'm tracking how I react to bringing in more starchy foods. And not so good. I brought in plantains, and that spiked the glucose where I'm normally staying below 90. It spiked it to over 150 for, a good 30 minutes or 40 minutes. And that's not typical. So it's good to see. I like to look at the data, but I think I like the idea of checking with heart rate variability and being able to do that on a consistent basis with mealtime. And, maybe it's a little bit less stressful on the body knowing that you have to keep track of this on a CGM, and you won't really make the association that it's food related until you look at the data as a whole. So I know that you do, if we want to shift a little bit to activity, motion, a lot of our audience has undergone many surgeries. We are an implant illness community, people diagnosed with dysautonomia, POTS, orthostatic hypotension, and that kind of thing. So I know that there's a balance that needs to be found within the optimal amount of activity or movement and then recovery. And your book does touch on this. So can you share some practical strategies on how we can avoid overtraining or burnout, especially with nervous system dysregulation?
Yeah, so when you use heart rate variability, that's a way to find the stress balance, to find out where is your stress balance. And if you have those kind of problems that you listed there, your body tolerates much less stress than any person without these kind of conditions. And a very nice thing about these devices is that they show the condition, because very often when you present to your doctor or practitioner with these kind of symptoms, we have no lab tests, so no other biometrics, but it is visible in the heart rate variability. So just having that as kind of a proof of the condition is stressful is a very valuable thing. And many people with these conditions are the ones that are happiest about the pulse cure and this way of tracking their systems, that it becomes visible. And when it becomes visible, it becomes easier to manage the stress levels. And often they will tolerate a lot less activity before they get lactic acids or a huge need for recovery time compared to other people. So, but you still need to do some exercise, but you need to make sure that you're recovering enough. And what is most important, I think, is to identify the stressors that you don't need. Like, for example, many people will not tolerate gluten. Many people, when they do food intolerance tests, will find that they are intolerant to some foodstuffs. That is quite common with the people with these conditions you listed. So I would generally recommend people to do that, regardless of what they find. If they have such a kind of chronic condition, in my experience, so many of them have some food intolerance that they need to check it. Also, in the case that they don't have it, it's one thing less to worry about or to think about. So food can be very stressful for in these conditions. It could be useful to do some intermittent fasting. Many people find that having an feeding window of 8 hours, 10 hours maybe, somewhere around that area, is gives them less stress overall.
Yes.
So that could be an important thing. I don't know if you have experienced that among your
Yeah, I think
listeners.
that the decision fatigue that they get with trying to plan out all of the meals, 3 to 4 meals, and in dysautonomia, some of the traditional practices would recommend them to eat every couple of hours to prevent,
Oh,
feeling the symptoms. And
that is terrible.
they do wind up developing this like hypoglycemia if they don't eat as routinely. So instead of going that way, we work towards, again, not necessarily a ketogenic diet, but learning to, like you say, the intermittent fasting or time restricted fasting to keep it at least within that 12-hour window. And I really liked what you were talking about with the food sensitivities. We do in my clinic mediator release testing. So that is the MRT food sensitivity test, and it is a whole blood draw. So they can take this test without having to challenge. Most tests you have to challenge, meaning you have to eat it within 2 weeks of taking the test. But with the MRT, for people who are on a very restricted diet, they really are taking the blood itself and testing it in the laboratory to see if there's any antigenic effect or any type of inflammation that's noticed with the whole blood cells. So that's really key in terms of trying to reduce that stressor. How does that correlate? I guess if you were to look at data on HRV, what would we expect to see if we're sensing that might be a trigger?
Then you would see that the heart rate variability is lower after a meal. So that is one of the surprises I got when I started using the Garmin watch, that meals could affect my stress levels. That was totally new to me. That was a real surprise. So the first time I realized that was I was at work, normal day as a doctor. Usually I would have a salad for lunch, and on this particular day there was probably some celebration. There was some cakes and stuff, and I decided to not have the salad I usually had, and instead have 2 large pieces of cake.
Mm.
And my stress levels just went through the roof. And I couldn't understand, because I was doing the same job before and after lunch. And then I realized that what we're eating can affect the stress levels in a big way. And I'm sure that your clients, when they do the food intolerance test, quite a lot of them would have food sensitivities, I would guess.
Yep, and gluten is one that does show up often, along with certain, I guess, FODMAPs I do see a lot, but that's not something like we do elimination just in a short term while we bring that stress level down and reintroduce to see how they systematically react, but not with a tool like HRV. So I'm really excited about them implementing that to kind of track when they bring back the food.
Yeah, they can use that because any inflammation in your body will be visible in the heart rate.
Yeah.
So whether it's because of food or because of alcohol or because you've been training too much or if you have the PMS period, the week before menstruation, so many things can affect the inflammation level in your body, and it will be visible in the heart rate variability. But it wouldn't necessarily be visible in the morning rate. It could be that your stress levels is high in a certain time after the meal. So if I, in this case, had this cakes for lunch, it wouldn't necessarily affect my heart rate variability measured in the morning. So I might miss that if I just measured it in the evening. And I wouldn't necessarily understand whether it was a hard workout at 5 o'clock or the cake at 12 o'clock, for example. So this is why, in my opinion, it's important to have the 24-hour measurement and to see that. Because I compare it to going on a big shopping and only seeing the total and not the different items. So it's much clearer when you can see the 24/7 curves from the Garmin watch. And unfortunately, so far, it's only the Garmin watch that lets you do this. And I think with the conditions that you mentioned, which is, it's putting your health level really giving you trouble, then I think it's really useful to have that kind of a solution.
Yeah, without the stress again of having to get additional testing done, because this is a measurement that can be taken 24 hours a day. And I'm assuming the Garmin watch, similar to other devices like the Oura Ring, you can use it for sleep testing as well.
Yeah.
Okay.
Yeah. So it's very useful that you get a number on the quality of your sleep. Sleep score. So that is also very useful. Yeah. And you were asking how to find the food sensitivities. And if you see that there's a big difference between your fasting levels and when you're eating, that is an indication that you have some food sensitivity. So if I'm fasting, then I'm in the parasympathetic mode the whole time. It can be a 2-3 days fasting or fasting mimicking diet. Often I prefer, with this like 700 calories diet. Then I'm in a totally calm situation.
Okay. So that is another thing that when we do our practices before eating a meal, we say you want to either do left nostril breathing or get yourself in a parasympathetic state, because most people with dysautonomia, again, they have that just regulation happening. So I'm wondering, and I haven't looked at the data good enough, maybe you have some insights into this, like when you really have a condition such as POTS, postural orthostatic tachycardia syndrome, and you know that it's really difficult to get in parasympathetic mode, will you be able to get valuable information? I'm sure you will. But would you be able to notice the sympathetic dropping to parasympathetic in lieu of the other way around, like when it's time for mealtime? Would you be able to see it even when you're hindered in this way?
Yeah, you should be able to see the differences, yes. You may see that your stress level is higher than in other people, but you would see that there's a reduction in stress levels when you do things that kind of connects you to the vagus nerve or improve your general situation. You would see it. It may take much longer time. It may be harder to manage, but slowly and slowly, doing a little bit of the right things here and there, you would see that you would improve. Yeah.
All right, so many of our listeners are also interested in the nervous system regulation approach, so maybe to address trauma recovery. And so have you seen correlations with HRV and emotional health?
Absolutely. And if you have, complex PTSD or you have some childhood trauma, you have a high score on the ACE test, for example, you have an autonomic nervous system that is always on the guard, always vigilant, always, ready to act. And it doesn't allow you to get into the relaxed state as easily as others. But there's still possible to get better, to get it more, get calmer, for example, by doing breath work, meditation. And of course, when you can see it measured in the heart rate variability, which is like, this is like having a dashboard for your physiology so that you can get the intensity of your life measured in numbers. So it makes it easier to find a solution that calms you down. Because what heart rate variability and these devices show also is that we are very individual. So there's a huge bio-individuality that shows that what I react to by stress, you could be calmed. Some people like reading and are very relaxed when they are reading. Others would be stressed. Um, so this is a way to find out how you react to a certain stressor.
Yes, absolutely. It's like watching a comedy versus watching an action-packed movie right before going to sleep and trying to measure which one is more conducive to leading into a nighttime, or none at all, because we want to shut off blue lights, a couple hours prior to bedtime. So I'm
Yeah.
seeing how we can adapt, or what kind of protocols can be adapted to better our sleep response first, our sleep scores, because we need that deep restorative sleep, especially when we're in this chronic state of sympathetic mode. So kind of shifting gears just a little bit to environmental and like implant related conditions. So there's a condition that we know the term for it now is Asia syndrome. I'm not sure if you've heard of that, but the acronym Asia is for autoimmune, autoinflammatory, S for syndrome induced by adjuvants. So this is, again, for people who have had implants of any type, whether it's hernia meshes or even breast implants or dental implants, they're having this systemic reaction to the implant. And that's kind of making them very hypersensitive and unable to tolerate stresses of any kind. I myself went through a period of time where I was bedbound, had to be in a dark room away from my family, which was very difficult. I had a child. My child at the time, the youngest one was 3, and then the older one was 8. So I couldn't really tolerate even their voices much, as well as foods and things like that. So with these type of clients, they're very much in that hypersensitive state all the time. So how can they use HRV to try to kind of shift away from that gradually?
They may find, for example, just an example that I know about, that one person found out that when she was playing guitar and singing, then she went into the parasympathetic mode. Another person found out that when he was doing gardening, then he was relaxed. He was not relaxed in the sofa watching Netflix, but being outside and doing gardening, then he was relaxed. To his surprise, because it involves some activity, of course. And this is a way that you can find out that suddenly you see, okay, here I was relaxed. What did I do here? And or surprisingly, many in this situation will take a hot shower, and that is stressful to them.
That's true.
And many would find out that a bit cold shower, or having the room and the temperature in the bedroom, for example, a bit colder, that is more easy, or gets them into the parasympathetic mode. So this is how each of these persons must experiment and find out what relaxes them. That may be really surprising. It could be also as easy as being out in the sunshine.
True.
Sun exposure, we see more and more, is very important for our mitochondria, for our cells, for the metabolism in our cells. So if you are inside a lot, which maybe would be easier if you have these troubles, then you don't really want to go out. Maybe it's too stressful. But then you would also lack the sun exposure that could be so important for your recovery. So that could be something about what you would find when you go out doing gardening or doing easy walks, that this would be important for your recovery.
Yes, thank you for sharing that, Dr. Farrell, because like you said, some people think of work being non-relaxing, and they want to veg out in front of a TV and they call that relaxing. But again, we can have so many different triggers, not really making the correlation, but knowing that we're still stuck in chronic illness. So looking at that, I think it's very instrumental for people to take note with these devices. Is there a way to kind of diary it within an application, or would it be something they would have to track on the side?
Yeah, they would probably have to track on the side, except for Whoop, which would have a system of a journal that you are writing or putting in your checking boxes. And I just remembered what the surprises that you can get, because I work at the ER, and you would expect, or I would expect, that that kind of work is stressful,
Right.
just by default, right? That, okay, working at the ER is stress. But when I'm using my monitor on the Garmin watch, I can see that I'm calmer than during the night,
Mm.
even in a busy day. And that was a total surprise to me. And because earlier I used to think that I should limit how much work I do at the ER. But now I can see that that is actually really relaxing for me.
Mm-hmm.
So I can take double shifts. That is not a problem.
Wow.
While other things can be, eating is a much bigger stressor for me. So I need to take much more care about what I'm eating than what I'm doing, except for, of course, doing huge lectures or these kind of things. That I know is stressful, and particularly if it's late in the evening, it can affect the stress levels way into the night, much longer than I would expect earlier. Earlier, I would expect that I would be finished with the stress, 1 hour after the
Right.
lecture. No, it can last for 5 or 6, 7 hours.
Okay. So even after performing some type of stressful activity, like you mentioned, the alcohol can be 5 days. So any other activity we can expect to see variability 5 hours after that event. Okay.
Yeah. And
Very
also,
interesting.
I'm surprised that if I have a intense workout, particularly if it's a high heart rate, a lot of lactic acid, it can take many days before I get back into the recovery mode. And if you have one of these mitochondrial dysfunctions that always or very often accompanies the conditions that you mentioned, then you can tolerate a lot less intense activity before you get this lactic acid effect.
Right, exactly. And they develop the post-exertional malaise really, really quickly. I know we
Yeah.
start off with things like recumbent bike or swimming, not even walking, because most of the people have this, again, tachycardia syndrome, and that just keeps them in a elevated state. We won't call it anxiety, we'll just say elevated sympathetic mode. But so they start off very, very slow, and along with all of the other pieces, the diet or nutrition, the adequate rest, the exercise, but keeping in tune with how they're feeling. Now, I love the idea, Dr. Farrell, that they can monitor this and see the data, because a lot of people are very data driven. So they can actually see the data better. I guess that Apple Watch, you can track your heart rate on that pretty easily while doing exercise. But in terms of the magnitude that they get to, again, because they've been in this chronic state of illness for so long, they don't really achieve a magnitude that is quote unquote normal exercise. So it'll be good for them to use this tool again to see, are they heading in the right direction or are they overexerting?
Yeah. And it's also important to know that, as this is probably a lot of the algorithms, the way that these companies use artificial intelligence to present the result to you, when you have these conditions that you mentioned, it can be so different from the norm that you can get interpretations that is not correct. So often you have to look at the numbers yourself, and kind of override the message you get from the device, or that can happen. So just to know that is a possibility.
For sure. Yeah. Always look at the person before you look at the numbers.
Yeah,
So,
yeah, you must use your own intelligence. Like these devices have artificial intelligence. They have to use your heart rate, your movement pattern, your temperature, and your oxygen level. And use their algorithms, compare with millions of users' data, and present you with their best guess of what is happening in your life. Of course, you know a lot of things that this device does not know about you. And so you have to use your own intelligence and the artificial intelligence of the devices. And it's this combination that is so powerful.
So I know you've worked with patients recovering from a wide range of stress-related conditions. What's the most surprising or the most inspiring transformation that you've seen?
That is, I get flooded with people on Instagram showing me the curves, before and after, and they're just so happy that they're able to live again, and then be able to, although they say it's been a long process, it has taken much longer time than they would hope for, that their lives are changed. So there's just so many that I cannot recall like a certain person, but that this can, I think for these modern day diseases that we're talking about, these devices tracking heart rate variability is as important as antibiotics for infectious diseases. There's so much inflammation involved in the diseases that we're talking about here. And tracking the heart rate variability is really useful to manage this. Or I can mention one person that I can recall. He had a rheumatoid arthritis, and he had been using medications and been having pain for many, many years. And when he started using the Garmin watch, started identifying that cold water therapy was very useful for him, he got rid of all the pains, all the medicines, just by doing cold exposure with the cold water. So of course, when they contact me and tell me this, it's very powerful to see the change that they are experiencing.
And you mentioned it before that it's very bio-individual. So everyone, even the cold water therapy, depending on the time of day you do it, it might be a stressor or not, but it's great that they can now make that association and determine what's best for them.
Yeah, and for many people with fatigue problems, they tolerate less not so cold temperatures. So they should start much slower than other people. Maybe just have a little bit colder shower, for example, and not be so long into the cold water. So they would have to be careful when they are in this cold water therapy.
And the heat therapy too. I know that if I take a hot shower, I might actually have more lightheadedness and dizziness. So ending with a 2-minute cold shower always is helpful for me. But it's strange because I can go in an infrared sauna and I do just fine. Or I can go in red light therapy, which, it does elevate the temperature of the body too. And I'm doing just fine, even if I'm in a laying down posture and I stand up, I don't necessarily
Yeah.
develop that.
But with infrared therapy, you strengthen the mitochondria, and you don't do that with a hot shower.
True.
With a hot shower, you just get the heat reaction, and heat is a very stressful.
Okay. What are your
So
thoughts on?
while many people think that heat is comfortable, it's also stressful. So you would want to have a warm shower, but I can see from the reports that people tell me that hot showers is really, really stressful for the people in this category that you have been talking about. But they want to have the hot showers, but it's not what they need. They would probably need a bit colder showers.
Right. And what are your thoughts on Epsom salt, like warm baths?
I would think that would be stressful. I imagine. I think warm baths is some of the more stressful things you can do, but I'm not sure, so I haven't tried it. But that would just be my what I would expect.
Yeah, I'd be interested to see how people react. And again, depending on the time of day, maybe they can measure the heart rate variability while they're in, if they're doing 20 minutes, and then, just really monitor how they're feeling up to 5 hours after, now that we know that time sequence there. So with that, how can people reach out to you, learn more about the work that you do? And actually, I know that I listened to another podcast episode you did with Dr. Nasha Winters, and I know you were working on some other books. Can you talk to us a little bit about that and how people can reach out to you?
Yeah, I've written the Pulse Cure, the book, and it's also an audiobook. Many people like rather to listen to a book than to read it. When I was talking to her, I was probably working on the book that was released in Norway 2 months ago, which is on the bestseller list now.
Congratulations.
So I have three books on the bestseller list now, actually. It's incredible.
Yes.
So that is a deep dive into the rest part of the Pulse Cure. In the Pulse Cure, it's kind of 10 pages on active, deliberate rest. And that seems to be the hardest thing for people. So the publisher wanted to make a book only on rest, or looking at stress from a rest standpoint, so to speak. And that has been really successful, particularly for this group of people, patients that we are talking about now. And what I'm starting now is an even more interesting book. It's on solar or sun exposure. Because we have been all wrong about that. We have been scared out of the sun. And of course, we are individuals evolved under the sun in Africa, until 50,000 years ago. So our cells, have lots of benefits from the sun. Now we know more about it. We know that there are nitric oxide stores in the skin that will be released with the sun exposure. In the mitochondria, there will be produced melatonin, that is an antioxidant, and the cytochrome C oxidase, one of the parts of the electron transport chain in the mitochondria, will be improved by the sunlight and producing more ATP in the cells. Of course, we make vitamin D. We make more testosterone, more serotonin, more dopamine, and a host of other benefits from the sun exposure. So, and that is really, it's free, it's cheap. And as long as you preferably do it in the morning light, it's a really good thing for your health. And we have been too focused on the small effect on skin cancer, and we have overlooked the effect on heart disease. Because if you get enough sun exposure, it can reduce the risk of heart disease, which is a big killer, by 30%. And it can reduce the risk of getting cancer of all other causes than skin cancer by 15%. So these are real big numbers. So and we can see it in the heart rate variability. So in the summer, the heart rate variability is better. And for Norwegians, this is a cold country, so many people go on a 2 week vacation in the sun at this time of year. And you can see it immediately on the heart rate variability that it improves while they are there.
Interesting. Yeah, I'm excited that book is already completed or is still underway.
No, now I'm in the research phase. So hopefully it will be out in January 2026 in Norway if everything goes as planned. So
very good, very good. There are so many things that we put out in terms of getting first light exposure, first morning exposure, and you mentioned trying to be out there. Is there, in your research to date, is there an optimal amount of time and optimal hours where people should be getting that sunlight exposure?
I think the most important is to get it. And I think already if you're in the sun 20 minutes, half an hour, even that's okay. And it's important even at this time in winter, even if we don't get a tan from the UV light, more than half of the sunlight is red and infrared light. And infrared red light will penetrate clothes and go through the skin. So even in this time of year, in March, it's still useful to be out in the sun.
Especially here in Florida, where we have a little bit warmer and more bright days, generally speaking, up until hurricane season comes.
Yeah.
Right. And I did ask earlier, I kind of glossed over it, but we really want to be able to reach out or find more of your resources. I know that you provide a lot of content in various languages, so where could we reach you?
I'm on Instagram, Dr. Torkil, dr.torkil. I'm on LinkedIn. I have a website called thepulsecure.com where we have a video that you can see, a video lecture where I can demonstrate what I've been talking about here, how you interpret the Garmin numbers in particular. So that could be useful for people to see.
Absolutely. Well, we appreciate your time, Dr. Færø. I know that the time difference is pretty big between us and is probably impacting your own sleep cycle. So we do appreciate you sharing all of your knowledge, your resources, and I know that I'm going to definitely be implementing this more in my practice.
Yeah. Thank you so much for letting me speak about this passion of mine. Thank you.
We appreciate it. And thank you to all our listeners. We'll see you on the next one.